Okay.
I give my consent to be recorded and the video uploaded into a video cloud platform for the exclusive use of assessing this student's competency in the Advanced Health Assessment course at MU.
Okay, so the patient is normocephalic. There's no lumps, tenderness, or deformities. Temporal artery is 3+ pulsations with no firmness. You open and close your mouth for me. The temporomandibular joint does have popping, but there's no pain, crepitus, jaw deviations, or teeth malformations. The face and the nasolabial folds are symmetrical. There's no drooping. Cranial nerve number 7, the facial nerve. If you could raise your eyebrows for me, open and close your eyes. Don't let me open your eyes when you close them tight. Let me see your teeth. Smile and blow out your cheeks for me. So that, thank you. There is a symmetrical muscle movement on both sides, and there is no involuntary movements. You can move your head back and forth to the left side and to the right side. So there's no torticollis or cervical dystonia. If you could clench your teeth for me, the masseters are equal on both sides. If you have any pain, I don't feel any tenderness, I don't feel any edema, so there's no issues with the parotid gland, the submandibular gland. I don't feel any nodules or edema. Do you have any pain?
No.
Okay, we're going to take a look at your lymph nodes, occipital, back of your head, postauricular, preauricular, submandibular, and your submaxillary, and then your submental. On one side, we're going to do the post-cervical chain, anterior cervical chain, and then your deep cervical chain. Same on the other side, anterior, and then deep, and then your supraclavicular. So the nodes that I do feel are small, pea-sized, non-edematous, and they were non-tender.
No tenderness.
Okay, trachea is midline. We're going to look at your thyroid gland. If you could swallow for me. Okay, so it's the same on both sides. It rises and falls with no nodules that I feel. I'll push it to one side. If you can swallow for me. So it's a fluid movement. I don't feel any nodules, any tenderness,
No.
and no edema. Same for the other side. Okay, so it's a fluid movement and no nodules that I feel. We're going to move to the eyes. If you could cover one eye for me. Tell me what number you see while you look at my nose.
1, 2, 2.
Okay, cover the other side.
1, 2, 2.
Okay, keep that one covered. Tell me when you see my finger while you're looking at my nose.
No. 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 No.
Okay, go to the other side.
No. 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 No.
Okay, take both your hands down and tell me when you can see my fingers.
Yes.
Okay, we're going to look into your eye, or shine a light right in the middle. We're going to look for your corneal light reflex, so that light shines in the same position in both eyes. If you can cover one eye for me, we're going to look for strabismus, so they don't deviate in or out. Go ahead and cover the other eye, so no esotropia or exotropia. If you can follow my finger, take your hand out, sorry. Look at my finger just with your eyes. We're looking for nystagmus, and we don't see any involuntary eye movements when you're doing that. Your eyebrows and eyelashes are equal on both sides. There's equal hair distribution. Eyelashes span out. There's no ptosis to your eyelids. Sclera is white. We'll take a look at your conjunctiva. It's pink and moist. Lacrimal apparatus is not edematous or erythematous. There's no discharge. There's no over tearfulness or dryness. We'll take a look at your eye off to the side. And the light shines all the way through, so the lens is clear. I'm going to shine the light in your eye. So the pupils are equal, round, and reactive to light. And there is consensual constriction on both eyes. If you can look at my finger, it's going to go towards your face. And there is convergence and constriction with both eyes. Okay, we're going to actually look inside your eye, okay? All right, so we're going to look for your red reflex. Follow it in. We're looking for your optic nerve and your optic disc. So I can see that your optic optic disc does have sharp edges, and your optic nerve sits in the middle. And there's a red reflex. We're going to follow it on this side too. Okay. So good findings on both sides. We're going to move to your ear. So the ear, they're equal in size and symmetrical on both sides. The pinna aligns with the outer canthus of the eye. There's no pain when you move the pinna or the tragus. Both sides, the external auditory canal don't have any discharge, edema, or erythema. And we are going to take a look inside your ear now. All right, if you could look towards the wall for me, we're going to pull your ear up and back. And we can see the cone of light on your tympanic membrane. Tympanic membrane is pearly gray, translucent. And the cone of light is at 5 o'clock on the right-hand side, 7 o'clock on the left-hand side. And we can see the handle of the malleus, the pars tensor and the pars flaccida. We're going to take a look at some of your hearing. You can tell me what side of or both ears. Can you hear that?
Both.
Okay. I'm going to put it behind your ear and tell me when you can stop hearing it.
Okay.
Can you still hear it? When does it
Yes.
stop?
Stop.
Okay. We're going to do the same thing on the other side. Tell me when it stops.
Stop.
Again.
Stop.
Okay. I'm going to whisper a word in your ear and you can tell me what that word is.
Blue monkey.
All right, we're going to move to your nose. Your nose is midline, septum is also midline. There's no discharge, no lesions. I'm going to take a look inside your nose in a minute. If you can cover up one side and take a deep breath through your nose, cover up the other side so the nares are patent. We're going to take a look inside your nose. If you can look up to the ceiling for me. Take a look. We can see that the membranes are pink and moist. There's no openings or lesions with the septum. The turbinates are smooth, pink, and moist with no lesions. We're going to take a look at your frontal sinuses. I'm going to have to tap your face. Do you have any pain?
No pain.
Maxillary sinuses?
No pain.
Okay. So we're going to move to your mouth. If you could open your mouth for me. You can see that your mouth is pink, moist, with no lesions to the buccal mucosa, the lips, the gums, the teeth are all intact, white, with no chips. Lift up your tongue for me, please. There's no edema, no erythema. You can stick out your tongue for me and say ah.
Ah.
So we see that the uvula and the palatine rise symmetrically. The uvula is midline. She does not have tonsils, they were taken out. And the pharyngeal wall is pink and moist. Her skin is pink. Clear from any vascularities, bruising. I don't see any edema. Skin is warm and dry. Thickness is consistent throughout. I don't feel any edematous areas. She does have numerous freckles and small macules that measure less than 1 centimeter. Nails have a firm nail bed with no pitting, no striations, no spooning. Hair distribution is equal throughout. Whenever you do your skin assessment at home, make sure you're in front of a full-length mirror with a hand mirror for places that you have a hard time seeing. And remember the ABCDEs of skin, asymmetrical, border for irregular borders, color, diameter, and evolution. Thank you.
Thank you.